Hi, my name is Nikki Licata, and I'm going to be demonstrating how to insert an indwelling urinary catheter. I'm going to start off by checking the provider's orders. The resident's name is Charlene Knight. Her date of birth is 8/08/1939, and her allergies are latex, penicillin, and betadine. And I have a Foley catheter insertion due to urinary retention. So I'm going to perform hand hygiene before entering the patient's room. Hi, Mrs. Knight. My name is Nikki. I'm going to be your student nurse for today. Can I get your first, last name, and date of birth? You'd say Charlene Knight, 8/08/1939, and her allergies are latex, betadine, and penicillin. I have the correct patient. I understand you've been having trouble urinating and you have a bit of abdominal distension. The doctor put in an order for you to have a urinary catheter, which is going to make you feel much more comfortable. I just have to assess your perineal area for any contraindications. So her bed is of working height. I perform hand hygiene again. Don my clean gloves. Okay, I would lower her side rail. I'm going to put you in the dorsal recumbent position, okay, Mrs. Knight? So now I check for any contraindications for the catheter. I don't see any signs of redness, swelling, or discharge. I'm going to palpate the bladder. She shows signs of discomfort and states she's in pain, so we can go ahead and follow through with the procedure. Remove my gloves. Perform hand hygiene again. I'll check the provider's orders once again for the Foley catheter. Charlene Knight, nothing she's allergic to is in here. For the sake of the video, I'm going to use an open bag, but normally, of course, I wouldn't use an open bag. But I would assess for any tears or holes. The expiration date is in 2017, so it's safe to use. We have hydrogen peroxide instead of betadine. I have a size 14 French catheter, and this is what this is. So we can go ahead and follow through with the procedure. You don't need this anymore, so I'll get rid of that. Remove this table. Don't need this paper. Use this as a trash bag. Under the bed. Now I'm going to start by folding over the farthest side away from me, maintaining my 1-inch border, then the left side, not crossing over my sterile field, then the right side, and then the side closest to me. Still not crossing over my border, I'm just going to adjust. Then I'm going to take my blue sterile drape, taking it from the inside shiny fold, stepping back. I just want so that you guys can know. Maintaining my 1-inch border. I know, but I was turning the other way. Now I'm going to drape this underneath the patient. And adjust it as needed. Now maintaining my 1-inch border. Just like that. Now I'm going to take my sterile gloves, put them to the side, perform hand hygiene one more time, making sure not to turn my back to my sterile field, keeping it in my sight. So right now I'm going to only touch the 1-inch border, making sure not to contaminate the sterile field. My dominant hand is my right hand, so I'm going to put that one on first, making sure to only touch the inside of the cup with my left hand, stepping back and putting my right hand in the supine position, making sure the sterile glove is above my waist. Now I'm only going to touch the inside of the cup with my sterile hand, stepping back, also putting this hand into the supine position. There we go. I'm going to adjust sterile to sterile. I don't need this anymore. I'm not going to be using this, so I can get rid of that. I'm going to interlock my fingers, keeping my hands above my waist. Now I can prepare my catheter. I'm going to move the box to the side, opening the kit. I'm going to remove the sheath from my catheter, making sure it doesn't flop over my sterile field. Don't need this anymore. My catheter is still in my sterile field. I'm going to apply the lubrication.
No.
Don't need this. I'm going to lubricate the catheter 2 to 4 inches up. Now I'm going to take my syringe, which is 10 milliliters. I'm going to make sure that this holds 10 milliliters, and it says 5 to 10 milliliters. If indicated, I would pre-test the balloon, but this package says we don't have to, so I'm not going to. Removing the cap. Twisting this in. Okay. Making sure the sterile field, also does not touch my scrubs, which it hasn't. Open up the hydrogen peroxide. Put it on my cotton balls. Don't need this anymore. Now I can begin the procedure. So now I'm going to clean her perineal area using my forceps. I'm going to clean the outer labia furthest away from me. I'm going to purposefully contaminate my non-dominant hand by spreading the labia. I will clean from clitoris to anus, going around my sterile field, making sure not to contaminate. Now I will go on the outer labia closest to me, clitoris to anus, make sure I go around my sterile field, down the middle, around my sterile field. Then I will go on the inner part of the further away labia, clitoris to anus again. Then the inner part of the closest labia. And then the middle again, clitoris to anus. Still around my sterile field. Don't need those forceps anymore. Don't need this anymore. Now we're going to go ahead and begin the insertion of the catheter. I'm holding it 2 to 4 inches away. Okay, Mrs. Knight, I'm about to insert the catheter. I just need you to bear down, take some deep breaths, and relax, okay? You're going to feel a little bit of pressure, and then you're going to feel much more comfortable once it's over. Going in, I'm making sure not to touch the labia or the urethral meatus with my dominant hand, keeping sterility. I would continue until I begin to see urine, which I do, and then I will insert another inch. Then I will stabilize with my non-dominant hand. I will inject the fluid into the balloon, making sure that the balloon is inside of the bladder and not in the urethra. Okay, I'll give a tug to make sure it's in, and it is. We're done with our sterile technique. I can take this away. Now at this time, after cleaning up, I would assess the patient's intake and output. I would perform perinatal care as needed. I would make sure she's okay, document how she took the procedure. I would chart color, consistency, and amount of urine excreted. And then Mrs. Knight, after I'm done, is there anything else I can get for you? She says there isn't, so I'm going to... I would also hook this onto her gown. I would attach here past the bifurcation with an adhesive, not with tape. And I would hang this underneath the side of the bed, making sure it's not on the bed rails. And we'd be done with the procedure. Thank you.